Been a rise in cases of gender-based violence, especially around the COVID-19 period. In the 20 years that the center has been in existence, for the first time we had over 4,000 survivors of gender-based violence. It's never happened in the 20 years that we've been in existence. And how this spanned out is that it's also changed the prevalence, or rather the kind of cases that we were getting. So we had more teenage pregnancies, for example. In 1 year we had 208 girls getting pregnant. We had late presentations. We had a lot of survivors coming in for medical treatment way after 72 hours. So hence you'd get more survivors getting HIV infected, more, yes, just as mentioned, you know, pregnant. So we'd have survivors who'd really you deal with the manifestations as opposed with the preventive, you know, of the diseases and such. We had a lot of mental wellness issues, you know, and survivors who, and even frontline workers, for the first time, yes, frontline workers undergo secondary trauma, but now it was worse. And it was very complicated because then you had to worry about COVID-19, and then you also had to worry about gender-based violence. So that also complicated survivors not being able to come for medical treatment, for example, because they were fearing out go to the hospital and get infected, or even because of the cessations, getting, you know, unable to like leave the area where they're with the alleged perpetrator to get the help, and just a lot of that, and a lot of stigma and discrimination around.
How was your center able to cope up with all those cases, and did you have to put in more measures? Yes,
we had to change a lot of the ways that we do service delivery. Very few survivors at the start especially would come for medical treatment, so we had to put in a toll-free number, start a toll-free number where we'd get survivors would be able to call and be able to go and rescue them. We had to talk to, you know, personnel, like the security personnel, to be able to allow some survivors, you know, to be able to access the services. We had to do a lot of awareness in the main media stations, but also the local ones in vernacular, because we have 9 centers spread across, for people just to understand that you can come and seek help, and there are correct measures, you know, around prevention of COVID-19, and it's still safe to come for medical treatment. We had to have partners who now would even give stimulus, you know, cash transfers, because a lot of survivors had to leave their homes, you know. We had to start now getting into delivery of sexual reproductive health commodities. So for example, sanitary towels. A lot of girls would get their sanitary pads through the education system in schools, but schools were closed for 9 months. So now we had to now provide that, because we had girls who would leave home to go get into relationships, of course now defilement, to be able to buy pads and such situations. So we really need to change. We really had to get very serious with our mental wellness for ourselves, for other healthcare providers beyond the centers, for the police, for the teachers. So that had to happen. We also had to look at the previous programs that we had, because now we could not go to the communities. For example, we had the Beacon teachers. So this is a movement of teachers, and we had worked with TSC before. So we use the teachers to use the same models, for example, in churches, in worship places, to be able to share information with the children.